Hi everybody, I'm Dr. Nari Heshmati. I'm a board certified OBGYN north of Seattle in the Everett area, and today I'm going to talk to you about nausea and vomiting of pregnancy. First off, before I start, with all these videos, we're really blessed in the Puget Sound area. We've got some amazing scenery, so I try to show some of that off at the start of each of these. Today I'm in Everett, Washington, where I practice, and in the background you can see we've actually got the naval base. That's Everett Naval Station out there, and that is actually the home port for the Naval Carrier Strike Center. We're also not too far from the Everett Marina. The Everett Marina is actually the largest public marina on the West Coast. So, with that said, nausea and vomiting in pregnancy. If you're watching this, you're probably pregnant, you're probably having nausea and vomiting. So, if it makes it feel any better, this is a really common thing. About 50 to 90% of pregnancies have nausea, and about 50% of pregnancies have vomiting. Luckily, there's very, very few that have hyperemesis gravidarum. Now, hyperemesis, hyper is too much, emesis, vomiting, gravidarum, pregnancy, so too much vomiting in pregnancy. That affects anywhere from 0.3 to 3% of pregnancies. Now, that's a very significant spectrum of nausea and vomiting. In those cases, patients actually can lose about 5+% of their body weight, and they often need to be hospitalized, and we need to really work with them through IV meds and try to get them tolerating things again. Now, for most people, nausea and vomiting of pregnancy is going to be something that's primarily a first trimester issue, and it's going to go away as the pregnancy advances. In the majority of people, nausea and vomiting starts about 5 or 6 weeks. It's going to peak around 9 weeks. Now, it is the number 2 reason for hospitalization in pregnancy. It's second only to preterm labor. Now, if you take a look and you go, well, why do I have all of this nausea? We don't actually know. But things we do know. The HCG, the pregnancy hormone, what we test for when we do blood work for a pregnancy test, it's released from the placenta. It correlates with the timing on the peaks of nausea. So that probably has something to do with it. Now, we do know there are certain people who are automatically going to be more prone to having nausea in pregnancy. So, for instance, let's say you take oral contraceptive pills, the standard combination pills that have estrogen in them. If you have nausea with that, you're more likely to have nausea during your pregnancy. The other things that seem to factor in is if you have reflux, if you have migraines, other reasons that you're more likely to have nausea in pregnancy. There is some kind of genetic component here because if your mom or your sister had nausea, you're more likely to have nausea. And, don't go out and buy a pink stroller or anything like that yet, but if you're having a girl, you're more likely to have nausea in pregnancy. Now, I'm going to make a quick plug for prenatal vitamins. We always recommend prenatal vitamins to start before you even conceive a pregnancy. The folic acid in prenatal vitamins, if taken 3 months prior to conceiving, can actually lower the risk of neural tube defects like spina bifida. But here's another reason for you. In studies out there, if you're taking a vitamin before you actually conceive, you're less likely to have nausea during your pregnancy. So that's a quick plug for that. Now, assume you're pregnant, you're having nausea. Is there anything we can do to make it better? So we're going to start from more conservative to kind of getting more aggressive things. So one of the easiest things you can do are diet changes. So if you take a look at it, we often recommend bland meals, nothing spicy, nothing with a huge aroma, and you're going to want to eat frequently, every 1 to 2 hours. The kind of meals we're talking about we often refer to as the brat diet. Bananas, rice, applesauce, toast, tea, things like that, dry crackers. Cold foods are often better than warm foods, and the reason for that is sometimes certain aromas, scents, smells, those are going to set you off. And a cold meal often has less of that, and it's going to be easier to eat. You're not taking a whole lot of time to prepare something, which can really give you time to get nauseous. Clear liquids, as far as liquids, are often a good thing also. Now, you'll notice a lot of the foods I just talked about are primarily carbohydrates. That's something anecdotally that in obstetrics we've always talked about. There is data out there that if we start focusing a little bit more on proteins, so if you can find some bland proteins, that may actually help nausea also. Now, let's assume you've made all these diet changes, you're eating frequently, you're drinking liquids, it's just not helping. You need something a little bit more. Well, one of the easy things you can do is ginger. Completely natural, it's available in multiple different forms. They have ginger lollipops, ginger snacks, ginger drinks. Any kind of ginger helps with nausea. We've got data that supports that. It doesn't necessarily decrease the amount of vomiting someone's going to do, but it's going to make them feel less nauseous. So ginger. Now let's say you're doing the ginger, you're doing the diet changes, still having nausea. The next thing you want to try to add in is B6. Over-the-counter vitamin, 25 milligrams every 8 hours. That's going to help with nausea. If you want to take it a step further after that, you can go ahead and add, there's an over-the-counter drug called doxylamine. Now, this is an antihistamine, so it's going to make you drowsy, so keep that in mind. It's readily available as a sleeping aid called Unison, so you can combine that with the B6. Now, that's essentially what, there's a prescription drug now on the market called Diclegis, and that's a combination of both B6 and the doxylamine in a slow-release extended capsule. So that's another thing that you can try just over the counter and readily available. Some things that don't seem to work, they've got the little pregnancy nausea bands. We just don't have any data that seems to help. Let's say you do all of these changes and you're still not getting where you need to be. There are plenty of prescription drugs out there. Just call your OBGYN, whether it's promethazine, ondansetron, metoclopramide. We've got a long list of things that are going to help if you're not able to keep things down. Now, one of the concerns that will often come up with patients when they're having a lot of nausea is they look at it and they're really concerned. Is this going to have an effect on my pregnancy? How is this affecting my baby? Well, you can rest assured. If you're having severe nausea, then we've got to really take care of it if you're not keeping things down. But in general, pregnancy outcomes are very favorable. We don't see a whole lot of risks. We don't see a whole lot of problems. So we want to do what we need to do to get you feeling better and get you where you need to be. But focus on that. I wouldn't worry necessarily, is this going to have a long-term effect on my pregnancy? So I hope that was helpful. I hope those diet changes and just having a little bit of background of nausea and vomiting are helpful. And look forward to the rest of the videos. See you guys later.